Welcome to the Medical Excellence Center. Today's lesson is about understanding lidocaine toxicity, and we will use the SAMS mnemonic to help you remember possible signs and symptoms of lidocaine toxicity. Introduction to lidocaine. Lidocaine is a medication that belongs to the class IB antiarrhythmics. It is commonly used as a second-line treatment for certain heart rhythm problems, especially after a heart attack, myocardial infarction. Lidocaine helps to stabilize the heart's electrical activity and is effective within a therapeutic range of 1.5 to 5.0 mcg per milliliter in the blood. Importance of the therapeutic range. The therapeutic range is the concentration within which lidocaine is effective without causing harm. If the concentration of lidocaine in the blood rises above 5 mcg per milliliter, it can become toxic and lead to serious health issues. It is crucial to monitor blood levels of lidocaine to prevent toxicity. Recognizing lidocaine toxicity, the SAMS mnemonic. When lidocaine levels become too high, toxicity can occur. To remember the signs and symptoms of lidocaine toxicity, you can use the SAMS mnemonic, which stands for S stands for slurred speech, A stands for altered central nervous system, M stands for muscle twitching, S stands for seizures. Now, starting from the first S, slurred speech. One of the first signs of lidocaine toxicity is slurred speech. This occurs because lidocaine affects the central nervous system, leading to difficulties in articulating words properly. A. Altered central nervous system. Lidocaine toxicity can cause various changes in the central nervous system. Patients might experience confusion, dizziness, and even hallucinations. It is important to monitor for any unusual behavior or mental status changes. M. Muscle twitching. Another symptom of lidocaine toxicity is muscle twitching. These involuntary muscle movements can affect different parts of the body. Muscle twitching can be mild at first but may progress if the toxicity worsens. S. Seizures. Seizures are the most severe form of lidocaine toxicity. They are a medical emergency and require immediate attention. Seizures occur due to the overstimulation of the central nervous system by excessive lidocaine levels. Preventing lidocaine toxicity. Preventing lidocaine toxicity involves several key practices. 1. Closely monitor dosages. Ensure that lidocaine is administered at the correct dosage and frequency. 2. Regular blood tests. Regularly check blood levels of lidocaine to ensure they remain within the therapeutic range. 3. Careful administration. Avoid inadvertent intra-arterial injections, as these can cause local anesthetic toxicity even at doses below systemic toxic levels. Use ultrasound guidance for regional anesthesia to ensure accurate needle placement and minimize the risk of accidental intravascular injection. 4. Use of adjuvants. Shocked face. Consider adding vasoconstrictors like epinephrine to lidocaine solutions to reduce systemic absorption and prolong the effect. 5. Emergency preparedness. Shocked face. Be prepared to manage potential toxicity with appropriate interventions, such as lipid emulsion therapy, which can be effective in treating severe local anesthetic systemic toxicity. 6. Patient education. Educate patients on the symptoms of toxicity so they can seek help immediately if they experience any signs. Conclusion. Understanding and recognizing lidocaine toxicity is essential for safe medical practice. By using the SAMS mnemonic, we can remember the key symptoms: slurred speech, altered central nervous system, muscle twitching, and seizures. Staying within the therapeutic range and closely monitoring patients can prevent toxicity and ensure the safe use of lidocaine in medical treatments. Thank you for learning. Join us and save a life at the Medical Excellence Center.